Hi, everybody. We'll just give a minute for everyone to connect in. All right, and we'll get started and as people come into the room as well. So, hello and welcome to the George and Fahey Center for Healthcare Innovations 2023-24 Patient Engagement Lunchtime Learning Series. I'll start us off with some housekeeping items. We have time for discussion at the end, but you are welcome to ask questions or comment in the chat at any time. To use the chat box, click the chat button at the bottom of your screen and enter the text where it says type message here. You can send messages to everyone in the meeting or to specific people such as myself using the drop box above where you type your message. If you have any trouble with Zoom, please feel free to reach out directly to me at any time during this call. We also have auto transcription enabled, so you should see closed captioning for the session. If you want to toggle this off or on at any time, you can do so by using the caption button at the bottom of your screen. This series is accredited by the Royal College of Physicians and Surgeons of Canada as a group learning activity. You may also be eligible for credits towards requirements of other professional bodies, such as the College of Pharmacists of Manitoba and the College of Registered Nurses of Manitoba. If you'd like to receive credit for your attendance, please make sure your full name is shown in this call. You can rename yourself by clicking on where you would see your video and select rename, or by clicking the participants button at the bottom of your screen, finding your name and hovering over it and selecting more. There you'll also find an option to rename yourself. We will be sharing a link to the recording on YouTube and slides with everyone who has registered. Now I would like to welcome Dr. Kendra Rieger. Dr. Rieger's research explores the arts as a way of knowing, disrupting, and healing in healthcare, and advances arts-based responses to the Truth and Reconciliation Commission calls to action. She is passionate about working collaboratively with patients, communities, healthcare partners, and colleagues to conduct respectful, responsible, relevant, and reciprocal research. In this session, we will hear about her engagement with First Nations women with experiences of breast cancer through storytelling approaches. Welcome, Dr. Rieger, and I'll turn it over to you now.
Thank you very much, Victoria. It's really great to be here with all of you today. And just a huge thanks to the Center for Healthcare Innovation for inviting me to share about our work today. I'm going to open up my PowerPoint and just want to acknowledge a few people as well. But first I want to say I'm very grateful to live, work, and play on the traditional unceded territories of the Stalo people. I actually grew up here in the land that is known as BC, and then spent 20 very good years in Winnipeg. I really learned to love Winnipeg and people there. And most recently was working in the University of Manitoba College of Nursing. And I moved back here to BC about 3.5 years ago to be near family, and also received a research chair award from Health Research BC. So today I'm really presenting on behalf of our team. I don't see this at all as my work that I'm presenting, but I'm presenting the team's work. And we just have this amazing team of people, and I'll introduce some of them as we move through the presentation. But also right now I want to say I'm very grateful to Elders Mabel Horton and Sherry Copenes, who have guided this stream of work. And you can see each of the names of our team members listed on this slide. I'm also very grateful to the Center for Healthcare Innovation for a PrEP award, which was actually the seed for everything I'm going to talk about today. And we went on to receive CIHR funding and also the Health Research BC funding, which supports my research program. So here is a photograph of only a few of our members of our 20-member team. And this was at one of our relational gatherings. So we're a team of Indigenous and non-Indigenous researchers and Indigenous elders, patients, healthcare professionals, and administrators. And we have no conflicts of interest to declare. I think you saw the workshop objectives in what Victoria sent out, so I won't review these, but just wanted to have them here on the slide in case you wanted to take a quick look at them. And moving on to what I'm going to present today. So I think what I'm going to present today is a good example of how arts-based approaches, and especially storytelling, can be used to engage patients and the public in a culturally relevant way, and to understand the health and illness experiences of First Nations people to promote health equity. So in this presentation, I'm actually going to share about a stream of projects. I'm first going to share a background of the digital storytelling project that was part of the description of this session, and then share about our phase 1 of our study in which we conducted the digital storytelling workshop and took place in Winnipeg when I was at the University of Manitoba. We'll then have a short time for discussion questions, and then I'll move on to discuss phase 2 of this work, which was a participatory scoping review of storytelling in Indigenous health research. And this work was initiated when I lived in Manitoba and completed while I lived in BC. And then we'll have a time for question and answers. So a bit of a background to our storytelling project. The first one, the digital storytelling project. As you may know, in Manitoba, breast cancer mortality has increased for First Nations women, while it has decreased for all other women. And as well, First Nations women are actually significantly more likely to be diagnosed with advanced breast cancer. So findings announced by the First Nations Health and Social Secretariat of Manitoba show that the life expectancy for all First Nations women and girls is 72 years. And this is lower than all other Manitobans by 11 years. Clearly, Western approaches to Indigenous research and healthcare practices have had limited effectiveness on patient outcomes. And we believe Indigenous research methods are needed to identify reasons behind these health disparities and also to integrate Indigenous knowledges and practices into current healthcare services. So storytelling has been long used by Indigenous communities to share knowledge and is increasingly being used in health research as an approach by Indigenous people and settlers to privilege Indigenous perspectives. As a form of arts-based inquiry, storytelling can really open up alternative avenues for expressing life's experiences. And these are avenues which can engage people physically, mentally, socially, and spiritually, which we found to be a very important component for patient engagement. Storytelling also provides a container for holistic knowledge, which is congruent with Indigenous values. So we did this early review on digital storytelling as a method in health research. And digital storytelling, many of you may know about it, but it's an arts-based method that involves creating a 3 to 5 minute video using multimedia materials to share a personal story. And in our systematic review, we found that digital storytelling is increasingly being used in Indigenous health research. I actually want to share this video, so I'm going to reshare my screen because I didn't click the button that says to share sound. And so hopefully now you'll be able to hear it. But as our workshop that I'm going to describe was a patient engagement project, we don't have ethical permission to share the participant stories with you. So to give you an idea of what, no, I'm just going to try that one more time. I don't know if I shared the right screen. Let's see. I think you're seeing it now. As our workshop was a patient engagement project, we don't have ethical permission to share their stories. So I often like to share an example of a digital story in research. So for those of you who haven't seen it, you can know what it might look like. So here's a 3-minute digital story created by my wonderful colleague and team member, Dr. Marlon Bennett, who actually facilitated the digital story workshop, which I'll be talking about. So she created this as part of another research project.
I'm the third oldest of 6 children born to my mother, Virginia. When I was 12 years old, my mother passed away from leukemia. She was only 32 years old. My brother and sisters and I grew up in care despite the fact that we came from a large extended family. I often say that I know my mother better in death than when she was alive. As a child, I was often hurt and confused about my mother's choices. I didn't understand why we were so poor. I didn't understand why she was not always affectionate like the mothers of my friends. I did not know then that my mother was a residential school survivor because she never talked about it. Had I known, I might have understood her better. I might have understood why alcohol seemed so much more important to her than us. I might have been more forgiving. I might have been more patient. It wasn't until years later, when I was older and had learned more about the history of residential schools, that I realized alcohol was my mother's way of coping with untold pain and recollections born from her residential school experiences. There are many memories about my mother that I hold dear in my heart. One in particular stands out. Even though my mother struggled with alcohol, I never doubted her love for us. On the mornings when she was able, she would get up early to make us breakfast, and she always made porridge. On those days that she made porridge for breakfast, I would go off to school feeling more satisfied and happier than I had ever felt. It always made me feel that everything would be okay and that the world was right because my mom truly loved us. It dawned on me years later that the simple act of making porridge was my mother's way of showing us that she cared for us and that she loved us. I wish I had the chance to tell my mom that I understand now why she struggled so, that I forgive her, that I miss her, and that I love her too. I've been told that I was fortunate to have grown up in foster care, as if that somehow made me into the person that I am today. It has to a certain extent, but the real credit is simply due to the enduring strength of my mom's love. My mom's love was cooked into every bowl of porridge served. This small but significant and loving gesture has sustained me, my sisters, and my brother to this very day.
So this beautiful story created by Dr. Marlon Bennett was created in a different research project, but I think it really shows how meaningful these stories can be. In a research study, participants will often create their digital story in a 2 to 3 day workshop, which includes story circles, and then meet with the researcher to talk about the meaning of the story to them. The stories can also be used to share the study findings in creative knowledge translation with patients, healthcare providers, policymakers, and academics. So our research team was interested in conducting a research study to explore First Nations people's experiences of breast cancer with digital storytelling to inform healthcare services. We viewed our project as occurring in 2 phases. In phase 1, we wanted to engage with First Nations women to assess the feasibility and meaningfulness of using digital storytelling in a future research study. And based on this work, in phase 2, we would co-create and implement the larger research study. For the first phase, we applied for a Center for Healthcare Innovation PrEP patient engagement grant that allowed us to develop the study plans alongside First Nations women who had experienced breast cancer. And our goal was really to ensure that our research program is relevant, acceptable, and of high quality. A two-eyed seeing perspective and framework for research engagement guided our work. A two-eyed seeing approach values both Indigenous and Western ways of knowing as important for building upon existing knowledges. The SPORE patient engagement framework views patient engagement and research as existing on a spectrum from consultation, as you can see on the left, all the way to patient and public directed. Based on this framework, we aim to engage in a collaborative level of engagement with our patient representatives. And the goal of a collaborative level of engagement is to actively partner with patient partners throughout the research. The objectives of our digital storytelling workshop were to explore Indigenous women's meanings of breast cancer, to identify factors shaping their healthcare experiences to guide future research, identify the research priorities that matter most to the women, and assess if the research design and proposed methods are culturally safe and feasible. So our collaborative strategies to engage with our patient partners included a 2-day digital storytelling workshop facilitated by Dr. Marlon Bennett, who you can see on that photo, and myself, 3 talking circles throughout the digital storytelling workshop. And in these talking circles, We discussed First Nations women's experiences of breast cancer. We heard their perceptions of what knowledge needs to be developed to improve services, and we elicited their feedback on the workshop. So to plan this workshop and make sure it was meaningful, we offered tobacco and received guidance from a First Nations elder. We also consulted with leaders in Indigenous health research community. And through connections at Cancer Care Manitoba and the University of Manitoba, we were able to recruit 3 First Nations women with experiences of breast cancer to participate in our digital storytelling workshop. And we offered honorariums to thank our patient partners for their time. So once again, just want to say a huge thank you to Dr. Marlon Bennett, who facilitated the workshop, and I assisted her with it. And here's a schedule of our 2-day workshop, our digital storytelling workshop, which incorporated the conventional format of a digital storytelling workshop, but also integrated offering tobacco to the participants, smudging, 3 talking circles, and a feast. And we offered honorariums to thank our patient partners for their time, as I already said, and their transportation costs were covered, and food and refreshments at the workshop. And that'll come into play a little bit later when I talk about reflections on the workshop. So as I said, here's an outline of our workshop, which included a mix of group sharing and then time that was focused on working on their own individual stories. And creating the digital stories involved writing the narrative and then recording it, and then working on iMovie or iPads to create a short video by combining personal photos and favorite music with their narrative, as you could see in Marlon's digital story that I showed you before. So throughout this process, solitary work was interspersed with social time and meals, and our workshop ended with this amazing viewing of all the videos, and they actually brought some of their family members as well to see what they had created. So here are examples of some of the questions which we asked during the 3 talking circles. And these questions were reviewed by all members of our team, our elder, and an Indigenous scholar as well. And just one example of a question we asked was, what helped you to cope and heal throughout your breast cancer experiences? So our workshop was held at the beautiful William Norrie Center at the University of Manitoba Inner City Social Work Program. And this facility has a round room, which we were able to use for smudging. So that was really important for our project. And our meals were catered by the Feast Bistro, which is an Indigenous owned and operated restaurant in Winnipeg. Our conversations with these women were profound and really provided such deep insights into their experiences of breast cancer. They told stories which illuminated the strengths that they drew on to find healing, but also the challenges they experienced within the healthcare system, and really troubling stories of racism. But they really, really found the workshop to be meaningful. One participant commented on the digital storytelling workshop and gave us permission to use this quote in a presentation. Some people have asked me about how I felt during my cancer experiences, but no one has asked me to tell my story until now. So we believe that the digital storytelling workshop was so meaningful for engaging First Nations women because we attended to the 4 directions of the medicine wheel within our time together. And this reflection on the slide was led by Dr. Marlon Bennett. So the workshops didn't involve just intellectual engagement, which is kind of the traditional Western academic approach, but also engagement with the emotional, spiritual, and physical aspects of life. So as you can see on the medicine wheel figure, we've layered on the different parts of our workshop to show how they attended to each of these 4 directions. So attend to the intellectual, we engaged in oral storytelling, writing a narrative. The creative process actually has some intellectual elements to it, and developing technological skills on the iPad. So to attend to the spiritual aspects, we incorporated prayers, offering tobacco, smudging with traditional medicines, and also meeting in a sacred room for part of the workshop. To attend to the physical, we incorporated really good food. We had a feast at the end, and then a viewing of the videos. We held it in a beautiful location, being in the round room for part of it. And Marlon painted each of the participants their own personal painted rock to give them as a gift. To attend to the emotional, we provided emotional support and sharing circles. The creative process was an expressive arts process, the digital storytelling workshop, and that definitely had very much helped people to express their emotions in their stories. So that attended to their emotions. when Marlon and I were reflecting on this, she helped me to see that by attending to these 4 aspects of life, we believe that the digital storytelling workshop facilitated a Debwewin journey, which Marlon taught us about. Gail writes that a Debwewin journey is actually an ancient Anishinaabe way of knowing that connects one's circle of heart knowledge and circle of mind knowledge. So this connecting of heart and mind produces one's Debwewin, which is defined as a personal and holistic truth that is rooted deeply in one's heart. So Debwewin enables one to speak from the heart, which is often lacking in tokenistic patient engagement initiatives. And from this perspective, there are 2 circles of knowledge, the circle of the heart and the circle of the mind. And authentic knowledge is located in the connecting of the 2. And that's what we believe the digital storytelling workshop helped to create a place where that could happen. And so here are some further reflections that we had on the digital storytelling workshop. We believe and we saw that it was a catalyst for deep connection between the women and us as well, and sharing when engaging with patient partners. It elicited many insights. I shared some of them already. And it was so amazing to see, actually on the last day of the workshop, probably the last hour, one of our patient partners said, I have a question. Can I join your research team? And all 3 of the women on their own initiative asked if they could join our research team. And they did join our next grant application to CIHR. And they were so committed to that project and met with me to work on their letters of support, and so responsive throughout that process, and have carried on with us into that project. One participant wrote about the workshop for the future grant application. It was one of the first times I had explored my cancer story and its impact on my life. I found telling the story of my cancer experiences to be profoundly healing and empowering experience. The inclusion of smudging and offering tobacco was really meaningful for the participants and created safety. And as well, having a beautiful environment and sharing meals created this special place for storytelling. One last comment from our future grant application that was successfully funded. One of our patient reps wrote, our patient partners wrote, it was a very eye-opening experience to hear the other women's stories and the struggles they went through and the strengths they drew upon in the workshop. It made me realize how complex our experiences are as Indigenous women. In this workshop, we came together to try to make this complex journey better for everyone. And this powerful experiences is why I'm interested in joining this research project. So that's the first project I wanted to share with you. And I've often, when I share about this project, I often see it as this really beautiful seed for the work that followed, and very thankful that the Center of Healthcare Innovation has this PrEP award, which can allow, especially newer investigators, to have the opportunity to engage in a really meaningful way with partners that have now gone on to multiple projects together. I think I'd like to take a few minutes to join small groups, and Victoria is going to assist us with this. And I have 2 questions which I'm going to pose for discussion. I'll bring this up again. What is one idea or reflection that you can take away from what I just shared, which can be helpful in your research or practice? And what approaches have you considered or used to facilitate authentic patient engagement and research? And then if you can ask somebody in your small group to have 1 or 2 sentences ready that you can pop back into the chat when you return, to kind of share with the large group a bit of a picture of the conversation that you had.
Okay, I'll open them up now,
Thank you, Victoria.
and I will broadcast the questions to the room as well.
Well, I'm sorry I missed his comments in the chat. That was really interesting about the iPads. Is the sound okay, Victoria?
Yep, perfect.
Okay. I'll be right back. Okay. Oh, hey, Carolyn. For some reason, the video, like when I shared my screen, all the pictures, all the faces went away, so I couldn't see people's faces. But I think a lot of people had their cameras turned off, so it's probably
It was really good, really interesting.
okay. Good. Yeah. What do you think about that? The thoughts. I love Marlon's thinking about the Debwewin journey and patient engagement.
I do too, and I love the idea of the circle of the heart and the circle of mind have to connect, because that sometimes seems like, yeah, we concentrate too much on mind versus heart, like that we have to build those relationships and take the time to build those.
Yeah, exactly. And then also the art-based approach of story, like the art, like digital storytelling really incorporates a few different art forms. And people really found that that helped too, because that brought out with cancer, especially people can really stuff a lot of, from the work I've done, patients have told me it's easy to stuff emotions down. And so
Yeah.
that enabled to bring out some of them in the story. And that enabled them to connect their mind and heart, because the system had, in a way, disconnected them,
Yeah.
which was really uncomfortable for them as from their Indigenous values, right?
Yeah. That is interesting. Yeah, because the physical piece too, right? Those 4 dimensions.
Yeah.
Art can really make a difference. Yeah, we've done some arts based even in just we had a group and they were developing their vision statement and how they wanted to proceed engaging, and they did the tree of life piece, but looked at like what are the supports, what are the, and how do we move, and kind of what are the branches, like how we want to move forward
Mhm.
together. And it worked really well.
Did you have the tree, like the outline drawn out already, or did they actually draw the tree?
We did have the outline
Yeah.
already, but then people were adding leaves
Because I
and
could see that really working with an outline done beforehand.
yeah, and then kind of adding what you think are the roots and then what you think is, yeah.
Yeah. Well, another great idea to take forward.
So many great.
Mhm. There's lots to explore, right? Just this kind of work takes time, right? And it takes more space and often more money too. So that can be the challenge with it. I think the time element, right? Like, so the workshop, it was 2 days and it could have been a lot longer. In retrospect, probably 3 or 4 days would have, that's like feedback we got, was that
Right.
they would have appreciated that. So that's a lot different than a 1 hour, or 2 hour patient engagement conversation that you might have in a focus group.
Absolutely. Yeah, having that. Oh, sounds amazing though. How you, yeah, all the different elements that you worked in too.
Tara Horrell has a prep grant right now, and
Yeah.
and Marla and I are both involved in that project.
Nice.
Using digital, she's using storytelling as well.
Oh, I'm so glad that you're involved in that one too.
She's part of this group as well. So that's an example of a partnership as well that kind of came out from this.
So great. And I see you, yeah, Anna Hudick was involved as
Yeah.
well. The
Yeah,
original.
because she was well connected, right, with CHI.
Yeah, and won a few prep awards too. So
And she just got a position, right, at U of M, I think.
yeah, a tenure in pharmacy.
Yeah. Oh, in pharmacy. I didn't know it was in pharmacy. For engagement, kind of like leading engagement.
Yeah, she's going to continue her engagement work, I think around cardiac health. So it's very
Oh, that's amazing. I didn't know it was in pharmacy. That's really wonderful. They hired somebody like that, like who has that specialty.
Just letting you know, we've got about 3.5 minutes left in the breakout rooms.
Maybe I'll quickly take a bio break, like really quick.
Yeah.
I just want to know I was here, but I'm getting ready for another meeting right away, so I've been just listening. Anyway, very good. And also, Kendra, as I just have left the board of the Canadian Breast Cancer Network, and I wonder if you're connected in any way, because one of the things we're really looking at is the whole IDEA thing, and you know, and we're all, you know,
Yeah.
old white women. So
Right.
I just I'm not
Oh,
quite sure if your contact information, I think it's on, I don't know if it's anywhere, but I would like to just put them in contact
Sure.
with.
Are you gonna, it's at the end of the session. Are you gonna be
Well,
there?
because I've got another meeting that starts at 1:15.
Let me go there and you can, I don't know if you can take it off the screen somehow. Diana, that would be wonderful to connect about that.
Yeah,
Let me just share the screen for a second. There you go. Can you see it?
just wait. I got to get a pencil. Yes, I can. Oh, that's very easy at tw.ca. Okay, thanks. I will let them know.
Thank you for
I
that's
think there's
great.
yeah.
And
Okay,
my
but lost
colleague,
already. TW, what was it?
here, I'll put it TWU.
Okay,
TWU.
.ca. Okay, thanks a lot. And I'm sorry, I gotta run
Thanks
around and find more pieces of paper.
Thanks for coming, Diana.
And just giving them the 60-second heads up.
Oh, right, yeah. That's always tricky getting that timing right.
Yeah. Yeah, you always have to set your timer for 1 minute less. So they close it early. Sounds like there's good conversation happening because no one's coming back early.
I think there's so much rich expertise likely in this group of people, right? And we always get inspired and then think about what we've done, and that would be a rich conversation if we had more time. I see it in the chat here. I love this idea of giving sweetgrass after someone shares. So that's important. I'm going to mention that because like the lands-based approach is so important. And I've really learned that moving out here in BC from elders I work with now. Oh, hi, everybody. Welcome back. Oh, it sounds like there was it looks like there was some rich conversations with you returning just at the end of the breakout rooms. And I just know that there's so much expertise and rich experiences in this room. So hopefully you're able to share some of that, and invite you to put it in the chat as well so that we can hear a little bit about what you shared. And thank you to Laura. I don't know if she's still here, but shared in the chat about her experience. And her point here about giving sweetgrass is meaningful in Ontario brings up a really good point that I should mention, is that these approaches we used were very local to the land we were on, right? And guided by elders when we were in this, when I was in the land known as Manitoba. And I really learned that moving out here actually to BC, working with elders here, how important it is to make sure that I'm seeking guidance from elders here as somebody who's trying to be an ally, and really respecting the traditions and protocol of the land on which I'm working. So thank you, Laura, for sharing that. I'm gonna, if you can pop one or two sentence summary or a word that summarizes your conversation, I welcome you to do that. I'm gonna pop my PowerPoint back up and continue on to our phase number 2. So as I mentioned, these 3 women joined our research project, and based on the feedback from the digital storytelling workshop, we embarked on a new research project in which they became full research team members. So for phase 2 of our study, we actually pivoted a bit, and our purpose was then to critically examine and elevate the uses of storytelling as a method in Indigenous health research. So we felt there was a need to actually, before moving forward with primary studies, to take a critical and careful look at how storytelling methods were being used in Indigenous health research. So we're very grateful to CIHR funding. It was actually SPORE funding for this project. And again, I've listed our amazing team, which included the patient representative, our partners from our earlier project. And we embarked on this project because, as I said, storytelling is increasingly being used as a research method, but given the profoundly troubling history of research with Indigenous peoples, critically examining how storytelling methods are actually being used was needed to see if it's being used in a good way. And we really found some wonderful ways it was being used, but also some concerning ways. So I'll share more about that now. So our purpose was to identify and examine how storytelling has been used as a method in Indigenous health research on Turtle Island, Australia, and Aratoria, and to do so in a relational way. And that was that last phrase was really important to our work. So here are our review objectives, which will frame the remainder of my presentation. And I'll kind of walk us through each one of these. So first, we found and critically reviewed all published research using storytelling in Indigenous health research to determine how this approach has been used. We then identified exemplary practices and problematic omissions using an adapted 4R framework. And then to imagine how storytelling could be used in the future, we are proposing a framework to guide the respectful use of storytelling in health research that involves Indigenous people and settlers. So our project had these 2 intertwining approaches. A critical participatory scoping review included the scoping review part, which is outlined in our protocol and our published review, but equally important, and I think was unique in this project, was gathering together to hear elders' teachings about storytelling and our Indigenous team members' perspectives of the role of storytelling in research. And you can see Elder Mabel Horton there on the right-hand side, who was just a key research team member and led the project. We led the project together. So we brought these 2 threads together, and how that really worked and happened in our project is we had conversations about this work at quarterly relational gatherings. And here's a photo of one of our relational gatherings. And so we held these relational gatherings at 6 key points in our project. And they were actually day-long gatherings, and the morning involved Indigenous ceremony, talking circles about storytelling that was led by our elders, and then sharing meals if COVID-19 restrictions allowed, and then discussions in the afternoon about review processes and findings. And this rich dialogue resulted in nurturing relationships between the team members, and that supported our collective interpretation and really helped us to map this literature and to think critically about it. It also supported Indigenous and Western worldviews coming together in a conversation. And these conversations transformed our review processes in so many ways. I'll just share a couple examples, but for one right now is that they guided us in determining what data was important to extract or collect from the included articles. Actually, after one of our relational gatherings, I had to go and had quite extensive revisions to our data extraction form that made for such a richer review. So we actually found 178 articles that included storytelling methods in Indigenous health research. And here's a Prisma diagram from our published review, which shows our study selection process. To be included in our review, the study had to be focused on health research and use storytelling methods at some point in the research process. Most people used it for data collection, but some for knowledge translation. And the study also had to include Indigenous people from Turtle Island, Australia, or New Zealand. The philosophy and methodology guide a study or review and are like putting on a certain pair of glasses that influence what you see. And so although 34% of our studies did not clearly state their philosophical or epistemological orientation, 31.5% of the studies were informed by an Indigenous or decolonizing lens. There were varied research methodologies within which storytelling methods took place, and most research teams used an Indigenous methodology or a version of participatory action research. The research purposes of the included studies fit into 6 overall categories with a wide variation in research topics. 61 studies focused on understanding Indigenous perspectives of health, and 23 studies on preserving Indigenous knowledges and culture. We think this is demonstrating a possible shift towards strength-based inquiries. Taking a more critical stance, 59 studies examined the social and structural roots of health and illness. And to a lesser extent, researchers explored the illness experiences of Indigenous peoples. 10 studies used storytelling methods to develop services or educational initiatives based on Indigenous knowledges and experiences, and 7 rigorously explored storytelling methods in research and practice. So we included studies from these 4 countries, which have common experiences with colonization. And most of our studies came from Turtle Island, which is also known as Canada and the United States. We noted that storytelling was used with diverse Indigenous population groups, which are summarized in this table here from our review report. And there is definitely a growing interest in storytelling methods over time, with over half of our studies being published since 2016. One question we went into this with is, when researchers say they're using storytelling, what do they mean? And we found that researchers use diverse storytelling approaches, which we categorized as individual interviews with storytelling. And some of these also included an art form, like having participants create a mandala. Yarning interviews are circles, and yarning was most commonly used in Australia, and it was similar to what we know as a sharing circle. Talking or sharing circles with storytelling, some of which included art, digital storytelling workshops, a mosaic of storytelling approaches, for example, sharing circles and individual storytelling interviews that were used in the same study, and then some really beautiful and unique storytelling approaches that were often really localized to the land on which they were conducted. We also developed interpretive findings, and we have 3 themes here that you can see on the slide and are detailed in our review report, but we only have time for a high-level summary today. There was many benefits, compelling benefits of using storytelling. It was flexible, relevant, and resonant for Indigenous peoples and communities. And these benefits were really a result of opening spaces which honored Indigenous ways of knowing, being, and doing. The positive impact of using a culturally appropriate method included centering Indigenous voices, which really could disrupt dominant practices and dominant narratives, which was really important with storytelling. Storytelling was culturally relevant, and because of that, it was a respectful research method. Participants reported finding it cathartic, healing, and satisfying. And also, it was valued for reclaiming, preserving, and illuminating Indigenous stories. But there was also problematic uses of storytelling, and there were notable concerns such as the lack of preparation and engagement with community for storytelling, a limited incorporation of Indigenous languages, missing details about research governance, and few knowledge translation approaches other than storytelling, other than publication, which to us seemed like a real missed opportunity, especially when they'd be collecting, let's say, digital stories and then would only publish their findings through an academic article. There were also several notable ethical challenges that researchers had to navigate. For example, considering OCAP principles with story sharing, especially as to who owns and shares the story that is collected. Our review report was just published, and we're now working on sharing our process and findings in a video as well, which CHI is also helping us with, Patrick Fouker from the knowledge translation area. And as part of our work, a second piece we're working on right now is we analyze, as I mentioned in our objectives, we analyze the included studies with the lens of an adapted 4R framework. And so this part of the project is a really great example of where our partner engagement made such a difference in our process. The 4 R's of respectful research that we were analyzing with were respect, reciprocity, relevance, and responsibility. And we had crafted these definitions for the 4 concepts and brought them to one of our team meetings, one of our relational gatherings. And I had done quite a bit of preliminary work looking at how different people define them and came up with these definitions. And when we brought it to our team, our Indigenous colleagues took a look at these definitions and just shared that they really were not resonating with them. And at first, this was kind of hard for me to take, but I just was like, I have to listen, and so it was a real pause in our project, actually. But then very graciously, Elder Mabel Horton and Lillian Cook offered to meet with me and go back to their traditional languages and share what those concepts meant to them in their traditional languages. And so our definitions became so much fuller and so much more meaningful after this process. And then we went with those new those conceptualizations that were relevant to the lands on which we had conducted this work. And we looked for exemplary practices and problematic omissions in storytelling research. And we just submitted a manuscript actually for this part of our project, and we'll be sharing about it in the video. And so I think that's to me, that was one of the most profound experiences I've had when authentic patient and public engagement shaped a research project in a profound way. So the culmination of our project is this framework to guide storytelling methods in Indigenous health research for teams comprised of Indigenous people and settlers, because that's who we were. We were a team comprised of Indigenous people and settlers. So to develop this framework, as I've shared already, we conducted this review of storytelling, and we analyzed our review findings. We also analyzed our 4R analysis that I just shared about. And then we went and actually analyzed all our meeting notes to look for considerations for respectful storytelling and health research. Actually, not our meeting notes, our relational gathering notes. So all the wisdom that elders had shared about storytelling. So the purpose is to provide a framework for the respectful use of storytelling in health research that involves partnerships of Indigenous and non-Indigenous people. And we're aiming to provide guidance for designing storytelling research that makes explicit the considerations for respectful decolonizing storytelling research in healthcare or in health research. Our framework is, we use the medicine wheel to show the cycle of storytelling and the 4 directions of storytelling. And we've grouped the considerations into 4 processes in storytelling research: preparing, growing, harvesting, and regenerating, and drew on the metaphor of a growing plant. So I'll just briefly describe these phases. Each of these phases actually has many considerations, but I'll just share one example from each phase, and then hopefully you can read about this soon or watch our video to learn more about it. So preparing involves considerations for creating safe spaces for authentic sharing, story sharing. So just as we prepare ourselves and the grounds for seeds and plant them, researchers need to prepare to work with storytelling. So an example of a consideration that came out, there's a real need to clarify the purpose and type of storytelling methods to ensure they align with the community's desires and the study purpose. Growing is the second component here, and that's really about doing good story work together. And so this is a time of intense growth during which we may learn many lessons and see and hear the growing stories. And an important consideration here is incorporating local cultural protocols and traditions into storytelling research methods. Harvesting is a time to share stories in a tangible, ethical, meaningful, and manageable way. An example of a consideration is being guided by the community and honoring their ethical framework principles regarding data sovereignty and ownership of stories. Regenerating is about enacting new knowledge and understandings to heal and amend the soil and create a better environment for future roots and growth. And an example here of a consideration is continued responsible sharing of stories within the arenas that are important to the community. So in kind of summary, my final reflections, it's been such an honor and joy to be part of this shared work, and I've really learned so much. And the elders on our team have encouraged us to share our learnings, and we hope that our findings can inspire people to conduct research in relational ways. The author of Braiding Sweetgrass aptly captures our intention, and I love this quote, so I'm just going to share it to close. We are showered every day with gifts, but they are not meant for us to keep. Their life is in their movement, the inhale and the exhale of our shared breath. Our work and our joy is to pass along the gift. So thank you very much for listening to my presentation today, taking some time out of your day. And I think we have a few minutes for questions or comments. So I just want to open up for those now.
And you are welcome to unmute or just pop your question in the chat and I can read it out.
Oh, thank you for all your comments here from your groups. I'm looking forward to reading those. Would you be able to send me those comments, Victoria, from the chat, please? Thank you.
I have a question. Thank you for all of your work.
Mm.
I was curious, on one of the slides you talked about collective interpretation, and I was writing down, so before I saw that slide, I said, I'm curious to understand about, or maybe talking through some of the inherent challenges with interpretation, especially for, maybe settlers interpreting Indigenous people's stories.
That's right. So that was really referring to interpreting the data extracted in our review. So we weren't interpreting Indigenous people's stories, but thank you for bringing that up, because that came up as a real challenge in this. It was a critique that our review had of the literature, that there were several examples of when Indigenous people's stories were interpreted by our settler researchers alone. So thank you for bringing that up. Yeah, collective interpretation, we really wanted to not just have a rubber stamp on our findings from the review, right? But how do you actually make, we included, everybody was invited to all parts of the relational gathering, which was really amazing experience. So all our patient partners, healthcare providers, they all came to the kind of the more research meetings in the afternoon, right? And so we really had to work hard to work creatively together to find ways that could make it manageable and meaningful for people. So often that meant myself and the research assistants and some of the core team members curating a bit of the data so it was manageable, like choosing sections that were really like where Indigenous team members' perspectives, community members were really important. For example, I think a great example is we had this whole theme, and we're actually publishing about it. So of how authors integrated Indigenous protocol into storytelling. And I just felt like this is an area I can't lead this interpretation of that part. Like there's some things like I can classify which countries the stories came from, things like that. But and so we actually brought we made about 3 pages of data, and we broke into small groups and teams of people from different perspectives. And we read through that data and had a conversation and recorded the conversation. I find that really helpful too, to record conversations. And so it's just more of a natural conversation, then I can listen to it later and take notes from it. And that was really what a lot came out in those conversations, which I would consider collective interpretation. But it was like, it doesn't just happen without like that thoughtfulness, right? And elders and team members' guidance. I hope that answers your question. Yeah. We're trying to get away from that rubber stamp, right? You send out your findings and what's your input for this 30-page document? Send it to me by email. Nobody responds.
We've got one in the chat. So
Oh,
we're
yeah.
wondering if you have any advice, or maybe you can point in the direction of where we can look for resources of how to facilitate a talking circle.
Mm. You know, there are some really good resources in our included studies in our in our published review, if you can get a hold of that and look through it. And we give a definition of talking circles, and I think we cite some people there. So, and there's part of the review also, we go through actually all our types of storytelling and provide examples and references for that. So that might be really helpful. We didn't do talking circles generally, but only talk, and that was really tricky with this. The hardest thing, one of the hardest things with this review was determining when it was actual storytelling, because whoever's a qualitative researcher here knows we use this term storytelling so often, right? Like just about any qualitative study, we gathered stories, right? Which in a way we do, but it often wasn't true. What our elders and Indigenous team members helped us to see, it wasn't true Indigenous storytelling. So that was really challenging, and it was tricky as a review like thing we had to navigate, but it also showed us like the philosophical problem of our settlers assuming they know what storytelling is. When we grow up, like storytelling to me, it's like a bedtime story, right? That a cute little fairy tale or something, but I just learned so much about the richness of storytelling from, I feel like I don't understand it yet, but I have like a small glimpse, right? The fog is starting to clear and starting to at least see how sacred, meaningful, essential it is. And so, so with the talking circles, it was especially challenging, those, because we had to really try to figure out when are they actually inviting storytelling, like in a way that really, it was participant driven. There wasn't researcher intervention, kind of researcher prompts throughout. So yeah, thanks for bringing that up, because that was a really important part of the review, that we also relied heavily on our relational gatherings to figure that out.
Wonderful. Well, since we are in our last couple of minutes, I will take a moment to close us off. And you are welcome to reach out to CHI or anything, and we are happy to connect you with Dr. Rieger if you would like to follow up. But I would like to take a moment to thank Dr. Rieger for the informative and engaging session. If you are able to, please join me in sending some virtual applause her way. I do have a few things to note for us before we close off, and Carolyn will be sending some links in the chat on my behalf. So firstly, if you have a moment, we would greatly welcome your feedback on this session, which you can find the survey link in the chat now. I'd also like to share with you our next session, which will be about why patient engagement matters in data science, engineering, and technology. To register for that session, you can find the link for our Eventbrite page there. And lastly, our PrEP award, which Dr. Rieger actually mentioned was a seed for some of the amazing work she is currently doing. We are actually opening our award February 1st. So I encourage you all to sign up for our newsletter to keep up to date on that release. And the newsletter link will also be available in the chat shortly. And on behalf of the Center for Healthcare Innovation, thank you all for joining us today. And thank you again to Dr. Rieger for her talk this afternoon. And I wish you all a good rest of your day.
Thank you.
Thanks so much, Kendra.
Thank you, everybody. Thank you, Victoria and Carolyn. Have a great day.
Yes, you too.
Okay, bye-bye.